good morning.
Good morning.
My name is Tracy. I'm going to be the nurse practitioner student taking care of you today. May I ask your name
My name is Erlan Bartley,
and your date of birth?
May 6, 1989.
Okay. And what brings you in today?
I'm here for my annual physical
When was your last physical?
about a year ago.
Were there any findings with that last physical?
No.
Anything changed since then?
No.
Okay. I'm just going to start by asking you some general questions and just to get an idea if there's anything that I need to focus on a little bit more. Do you have any allergies?
I'm allergic to peanuts.
What happens when you eat peanuts?
My face gets swollen, my throat gets dry and itchy.
When were you diagnosed with peanut allergy?
I think it was about 10 years ago, 10 to 15 years ago.
Okay, so you just have to be very, very careful with if you're eating out and what's in those meals, and make sure it's not even cooked with peanut oil. Do you have an EpiPen?
No.
Okay, so you should have something for that allergy just in case you're accidentally exposed. So we'll look into something like that today. Do you have any medication allergy?
No, I don't.
Okay. Any environmental allergies?
No.
Any allergy to latex?
No.
Okay. Are you currently taking any medications?
I albuterol inhaler
Why do you take albuterol?
for my asthma
Okay. When were you diagnosed with asthma?
when I was about 4 years old.
What dosage of the albuterol do you take?
I don't know.
Okay. Who do you see for your asthma?
My doctor named Miss Carmen. She works at Greer Medical Center.
Okay. And when was the last time you saw her?
About a year ago.
Okay. When was your last asthma flare-up?
I cannot remember that.
So how many times do you take that asthma medication?
About once or twice a week.
Okay, when was the last time you used it?
I think it was this week Monday.
Okay, why did you use it then?
I was exercising.
Okay, so do you normally use it when you exercise?
Yes.
Okay. Are you taking any supplements?
No.
Nothing over the counter?
No.
Do you take any medication over the counter?
No.
Okay. Any Advil, Tylenol, anything like that?
No.
Okay. Multivitamins?
No.
Okay. How about your past medical history? Any past medical history?
No.
Just the asthma?
Yes.
That's the only thing you've been diagnosed with?
Yes.
Okay. So pretty much the asthma, you'd say the asthma is well controlled?
Yes, please.
Okay. Any surgeries or hospitalizations in the past?
No.
Okay. How is your family doing? Is there any health issue?
My mother was diagnosed with diabetes and my father has hypertension.
Is your mom and dad still alive?
Yes, they are.
Okay. How old is your mother?
My mother is 68 and my father is 69.
Okay. Any siblings?
Yes, I have 2 siblings.
How are their health?
One of them has diabetes.
How old is the sibling with diabetes?
He is 40.
Okay. Any children?
Yes, I have 2 children.
Okay. Are the children healthy?
Yes, they are.
Okay. Now let me ask you about your social history. Any tobacco use?
No.
Any alcohol use?
No.
How about recreational drug? Any recreational drug use?
No.
Okay. How is your diet?
I'll say it's fairly okay.
Fairly okay. All right. Tell me a little bit more about your diet. Go back 24 hours and tell me what you've had for breakfast, lunch, and dinner in the past 24 hours.
For breakfast, I had 2 boiled eggs with a French toast and an apple. For lunch, I had a chicken salad. And for dinner, I had rice and beans with chicken and water.
Okay. Any snacks in between?
No.
Oh, sounds like your diet is fairly healthy. Do you sometimes cook at home?
Yes.
Okay. All right. Any exercise?
Yeah, I normally once a day or every other day, and play soccer on the weekends.
Oh, good. All right. Do you play soccer? What team do you play for? Are you in a league?
No, I'm not.
Okay, so do you have a favorite soccer team?
Yes, I do.
Okay. What's your favorite soccer team?
It's called Liverpool.
Oh, that's an English team, huh? Okay. How about your living situation? Where do you live?
I live in Malden.
Is it an apartment or a house?
It's a house.
Who do you live with?
I live with my wife and my 2 children.
Okay. Do you have any hobbies other than soccer?
Just listening to music.
Okay. Do you have any pets?
No, I don't.
Okay. Now, are you sexually active?
Not at the moment.
Okay. All right. Now, I do ask you a little bit more questions. I'm going to ask you a little bit more questions. And these are more in to find out what's going on with you or if there's anything I need to focus on a little bit more. Any fevers or chill?
No.
Okay. Any recent illness? Any recent infections or recurrent infections? Any rash anywhere on your body? Okay. Any headaches? Tremors? Seizures? Any loss of consciousness? How about sleeping? Do you have any difficulty falling asleep or?
I fall asleep well.
Okay. Are there any changes in your sleep pattern? Okay. Now, are you sneezing or coughing? Any nasal congestion?
No.
Any runny nose? Okay. Any sore throat? Okay. Any masses in your neck? Does your neck feel stiff at all?
No.
Okay. Any recent head trauma? Any head trauma at all? Okay. Any loss of vision? Blurry vision? So you're seeing pretty well. How about hearing loss? Have you experienced any hearing loss or any ringing in the ears? Okay. Is there a history of heart disease?
Not that I know of.
Okay.
Concerning my family members.
Nobody in the family with heart disease? You've never been diagnosed with any heart conditions? Okay. Any chest pain? Okay. How about wheezing? Do you have any shortness of breath or wheezing? You know, you say you're diagnosed with asthma. Do you experience any wheezing at all?
Not wheezing, but short of breath.
Short of breath?
When I'm like exercising for a long period of time.
Okay. What do you normally do for that?
I just take my inhaler.
Now, do you take it before you exercise or during exercise?
Before.
Is that what was prescribed by your doctor?
Yes.
Okay. When was the last time you saw your doctor again?
A year ago.
Okay. So you have been going pretty frequently. Okay. When is your next appointment with your doctor? Do you have one scheduled?
I'll try to get one during this month or next month.
Okay. Any urinary problems? Any difficulty urinating? Any pain with urination?
No.
Any blood in your urine?
No.
How about abdominal pain? Any nausea or vomiting?
No.
Any diarrhea or constipation?
No.
Okay. No diarrhea, no constipation. Recent weight loss that is unintentional?
No.
Okay. Any frequent urination? Okay. Thirst? Are you thirsty more than regular? Okay. Do you have any difficulty swallowing?
No, I don't.
Okay. Any muscle pain?
No.
Okay. Any pain in your joints or stiffness in your joints?
No.
Any muscle cramping? Okay. And any recent changes in your stress level?
No.
Okay. Any history of panic attacks? Any history of depression or feeling hopeless?
No.
Okay. One of the things I didn't ask as we were going along, what do you do for a living?
I'm a bank teller.
You're a bank teller. And is that not a stressful job or no? It's pretty easy going.
It's pretty easy.
Oh, that's good. It's really good. All right, now I'm going to move on to the physical exam, and that's where I'll, examine you and see if everything is okay. Alright, so is it okay if I touch you? Alright, so I'm going to start off with your head. I'm going to examine your scalp, make sure it's good. Alright, examine for symmetry. Inspect. Alright, can you open your mouth for me? Close. Open again. Close. Any pain with that? Okay. Alright. I'm gonna touch your forehead and you tell me if you have any pain when I press your sinuses. Any pain there?
No.
Any pain there?
No.
Okay. I'm gonna percuss. Just tell me if you have any pain, okay? Any pain or discomfort?
No.
Okay. Alright. So next thing I'm gonna do is cross your legs for me. Is look at your eyes. Now look over my shoulder. I'm just gonna use my light here to look at your eyes. Just keep looking over my shoulder. Alright, good. I'm gonna come close to you, look in your eyes. Okay. And next one. Good. Alright. Now, I want you to focus right on my shoulder on the wall over there, and just focus to the wall and back to my finger. Okay? Wall, back to my finger, to the wall, back to my finger, to the wall, back to my finger. Alright. Now I want you to follow my finger just with your eyes. No, don't move your head, okay? Alright, good. The next thing I want to do is for you to look in your ears, okay? Have you had any discomfort with your ears? Any draining, any discharge?
No.
Okay. The other one. Then I'm going to look in your nose. Tilt your head back for me a little bit. Just shine my light in your nose. Just take a look, okay? Alright, looks good. Alright, can you open your mouth for me? And lift your tongue up. Stick your tongue out. Say ah. Alright. And just open one more time. Okay. When was the last time you visited the dentist?
2 months ago.
Okay. Alright, so do you go pretty regular to get your teeth clean?
Every 3 months.
Okay. Do you have any dental pain, anything like that?
No.
Any problem swallowing?
No.
Okay. Alright. Let's pull down the lid of your eyes. Everything's okay. Now I'm going to move down to your throat. And I'm just going to feel your lymph nodes. Do you have any discomfort, any tenderness, any pain when I press there? Okay. Alright, can you swallow for me? Alright. I'm just going to ask you to turn a little bit because I want to feel your thyroid. Let's just get behind you a little bit. Okay, no swelling. Any discomfort with me touching there? Okay. Alright. You can turn around. Okay. I'm just feeling your artery that runs at the side of your neck. Feel the other one. I'm just going to listen as well, okay? Can you hold your breath for me, please? Excellent. Hold your breath for me again. Okay, good. I'm going to check your pulses. Good. Now, can you extend your hand out for me? I'm just going to touch your fingers. Okay. The next thing I'm going to do is touch your chest. Your chest. I'm going to do that on the back as well. If it just turn for me a little bit. Sorry. Thank you. Now listen to your heart. And you did say there were no history of heart disease, right? Okay. Now I'm going to listen to your lungs. And what I want you to do is, while I'm doing this, I'll give you directions to take deep breaths in and exhale, okay? In. Exhale. 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 I'm going to do the same thing on the back. Take a deep breath. Exhale. Deep breath in. Exhale. Deep breath in. Exhale. Deep breath in. Your lung seems pretty clear. I didn't hear any wheezing or anything like that. Now I need to do your abdomen. So I'd like for you to lay down for me. Oh, thank you. And I've inspected the abdomen. It's flat, it's symmetrical, and there are no rashes on the abdomen. So for your abdomen, what I'm going to do is I'm going to listen all quadrants, see if I can hear bowel sounds. Are you doing okay? Okay. Your bowel sounds are normal active. And while I'm down here with my stethoscope, I'm just gonna listen for your aorta. See if there's any burets there. Okay. The next thing I'm gonna do is percuss the area. So just tell me if you, while I'm doing, if there's any discomfort, okay? Now we're gonna percuss for the liver. Any discomfort? Okay. And I'll go over on this side. I'm gonna percuss for the spleen, okay? Any discomfort? Alright, so from here I'm gonna palpitate, which means I'm gonna push down on your belly a little bit If I'm gonna do it lightly at first, you tell me if there's any kind of discomfort at all, okay? And then I'm gonna go deeper. Any discomfort right there? Okay. Are you ticklish? Okay, then if you're ticklish, you can put one hand underneath my hand and just press with me, all right? Is that better? Okay, good. Okay. Now I'm gonna palpate for the liver. Put the find your ribs right here. All right. Now take a deep breath and exhale. Good. All right. And I'm going to do the same thing over here. Take a deep breath. Exhale. All right. Are you doing all right? Okay. Okay. And the next thing I do is palpitate if there is any. All right. You're doing good. All right. You may sit up. Okay, so what I'd like for you to do as far as follow-up is to come back in a year for another physical. Of course, you're more than, it's okay for you to come back if there are any issues, if there is any illness that you need to be seen for, but we want to schedule another annual for a year from now. There'll also be an appointment made for you to come and get some blood work done just before your annual, maybe a week or two before your annual. As far as plan, I would like you to follow up with your asthma doctor, Dr. Carmen at Greer Medical Center, just to make sure you are on the right protocol for your asthma. Make sure it's getting treated since you're experiencing shorter breath when you exercise. And exercise is very important, so we don't want to stop that by any means, but just to make sure that your asthma is under control. So that would be it for now. Do you have any questions for me?
No.
Okay, well, thank you for coming in, and it was nice to meet you. All right. Just follow up at the front desk for your appointment, okay?